Silvia, that was an outstanding presentation. You really went through the uses of the technology. You went through cases that could be very, very challenging, even with a milled stent, and showed just fantastic accuracy. So I commend you on the presentation, the quality of the surgery, and it was a real treat to watch. Thank you. So there were a few questions that came up. One was on pricing for the system. One I'm going to ask about the software. You showed in it, I know there have been articles over the years about prosthetically driven implant surgery, prosthetically guided bone regeneration. You showed exactly where you placed, especially in that first case, the long axis lined up with the central fossa of the premolar. You showed in the planning software that virtual tooth in place. Could you just quickly describe to the audience how easy it is to set up those virtual teeth and to plan the software? Because we've all had experiences with multiple kinds of software that we're told by the trainers how easy it is, anything from Photoshop to other kinds, and they generally don't tend to be as easy as we're told.
Certainly. Thank you. Thank you. That's a great question, actually. Well, like I said, there are two different ways of incorporating the virtual restorative plan. One, you can actually use the virtual crowns of the software that are basically there, easy to use. You basically, I will tell you one thing before I proceed with that. It's so easy that it takes me currently 4 minutes to plan a case. So basically you grab the virtual crown from the software and you align them with the jaw curvature, and basically you have your virtual crown. And you can change the virtual crown in width and height, so you can accommodate it to match the adjacent, the opposing natural teeth, right? Now if you use an intraoral surface scan, which is what I use both. So if I use an intraoral surface scan, I basically will have my laboratory create the virtual restorative plan. I approve it. I receive basically an STL file, which I then merge into the software. Again, that's basically 2 seconds. It is digital, so it's basically incorporating, like the icon file, the STL file into the software.
The lab, because what I've been doing with mine is I just move the teeth in by myself from the software, and I find even chair side in an emergency situation that can take as little as 5 minutes. And what you showed was also beautiful, where you can change the plan on the fly. We've actually done that in the office where, we all use 2D, 3D imaging, and sometimes the bone isn't quite what it looks like even on 3D imaging. So I know you showed it for lengthening. Have you also had to change on the fly to change the angulation of an implant?
Certainly. I have changed the angulation, the width of the implant. Certainly. I have. That is the beauty of navigational technology, of dynamic surgical navigation. You can change the plan from not only the position, the three-dimensional position of the implant, but also the implant that you're going to end up selecting. You can go from one system to another by just changing the width. And also the configuration. The software, I didn't show that, but even the software has different configurations graphically of the types of implants.
Dr. Hansen has asked what criteria you use for Transcrestal with either the Versa or the Reamers.
If I prefer to use one or the other, is that what the question was? Yes. Okay.
What your criteria is when you use Versa, when you use the Reamers.
Right.
In other words, I'm assuming he means the height, the residual native bone.
Correct. All right, so I will tell you this. I actually love currently using the alpha-densification technique with the DensaBur technology. When I was explaining how long I have been using both, the hatch reamer came way before the DensaBur. So again, I started using that in 2008, so way before Densa. DensaBur became available, I believe, in 2014, and I was probably a late adopter into the DensaBur technology, but I started using it in 2018, and since, I will tell you that that's what I use, because of, again, the principle, you're condensing laterally and vertically and epically the patient's own bone. You're not excavating the bone. So You saw me doing both techniques because I still will use the hash trimmer. However, I have a tendency now to lean towards the densaver technology only because, again, of the non-excavating technique and the condensation of the bone. And actually, well, when we look at the advantages of auto-densification, remember, for one is you're increasing the initial implant stability because you're condensing the bone in both directions, right, laterally and apically. So that's a great advantage, which I cannot obtain with a hash trimmer. The hash trimmer is an excavating technique. Again, I use it and I honor it. I used it for 10 years, and now I'm switching to the other side, to the better side.
Okay. Great. Dr. Kurtzman, who likes to make us all sweat, asked the traditional question about using it in fully edentulous cases, and I know there are cases where they're placing screws, placing pins so that we have other landmarks to use for the tracing. Have you tried any longer span edentulous cases or only with teeth present?
No, I actually personally have not tried yet edentulous cases. As you know, Dr. Rosa and I work together. He's the oral surgeon of the practice. He does a lot of edentulous cases. So I am going to let him take on that side of the navigational technology for the edentulous cases. I enjoy more partial edentulous, so yes. But I know that the technology is definitely in development to actually allow us to fully edentulous cases using, again, markers and pens, yes.
Great. Someone asked about the densivers, if they're one use only, and as usual, there are manufacturer guidelines depending on how many osteotomies and how dense the bone, so generally between 10 and 20 osteotomies. I think we've pretty much answered all the questions, both on the internal and the external chats. Any other last words of wisdom, my dear, that you can think of before we turn it over to Beth Boudreau?
Well, I think that, it's important to talk about learning a new technology, because I think for most people, sometimes we get frustrated because when we're trying to learn something, we want to learn it quick. And everything that we learn, we have to allow ourselves time to learn it. So I just encourage everyone to take your time to learn navigational technology. It's going to make you more accurate, more precise. Be patient always with any new technology and technique that you actually adopt. And I wish you the best, and I definitely invite you to come to our practice because it is fascinating what we're doing. I will tell you, I have not used a static guide this whole past year at all, zero. So I'm very excited. I'm excited to continue with the progress and also the other applications. As we mentioned, endodontics is in the field as well. And for me, I am looking at possibly, of course, doing bridge split and using the PSO for multiple applications. Using TAT, navigate TAT into place. That's another fascinating, application, even for SSOT. So there's definitely various reasons why we should be doing dynamic navigation, and I encourage everyone to definitely explore and to definitely ask us, because I think there's so much we can do with this.
I will add that people generally ask me are cost and training. I will say if you compare the cost of this to static guides, once you're using multiple sites with this, it's instantly cheaper than a static guide, because static guides start at generally $100 a hole, depending on the lab you use, and certain labs can start at $300 a hole. So you're much cheaper, you have irrigation, and you have, as was shown beautifully, the ability to change on a fly, which you can't do on a static guide. You don't have to worry about it not fitting, not getting there on time, or anything like that. And as far as training goes, the hands-on training in your office is 2 days, and by that time you are completely comfortable with both the hardware and software of the system. And the staff is available for email and phone support, and I've found them to be just wonderful. So I also recommend it very, very highly.